Okay, hello and welcome, ladies and gentlemen, to the first of many of Jom Sembang live session by Care Warrior Association. It is our great honor and pleasure to have all of you here with us on Thursday evening. Let us jog our memory a little and think back on the time when coronavirus was first discovered in China during the end of year 2019. What were your thoughts and feelings back then? There were so many uncertainties, and it created anxiety, fear, worries, and panic. Within a short frame of time, what started as an outbreak has then been declared as a pandemic by WHO in March 2020. During this past 1 year, Malaysians were faced with many challenges, be it at work or financial situations, relationships, and undeniably, this has taken a toll on our mental health. Moving on from MCO to CMCO, RMCO, CMCO, and now again MCO. What is pandemic fatigue, and what can we do to maintain or improve our mental well-being? Without further ado, let me introduce today's speaker. Today we have with us Dr. Amer Siddiq Amir Nordin, who is the director of the University Malaya Center of Community and Sustainability, UMCares, and he's also an associate professor in psychiatry and consultant psychiatrist in University Malaya. He obtained his undergraduate and PhD from the University of Otago, New Zealand, and his specialty qualification from University Malaya. He practices in both UMMC and UMSC and is heavily involved in patient care and advocacy. Dr. Amer is also the president of Care Warriors Association, which is the newly formed NGO, and he's also consultant for Emerging Journey Asia, UNICEF, WHO Regional Office, our Ministry of Health, and also Befrienders KL. He is also active in advocacy work and very much active in teaching and research. So with a very impressive CV, please welcome Dr. Amer. Dr. Amer, over to you.
Thank you very much, Dr. Lim. Let me just get this across to you guys. So thank you very much, Dr. Lim, for the kind introductions, and also for all of you here for being with us on this Thursday evening. As Dr. Lim had mentioned, today is going to be the first of many talks that we'll be having as part of this association, which I'll share with you a little bit in the coming few minutes. Now, let me just, as usual, when we're wanting these things to happen. Okay. Great. So for today, what I'm going to be doing over the next 30 minutes or so is I'm going to be sharing with you a little bit about who we are, recapping a little bit about health and why mental health is important, talk a little bit about COVID, very little, and also the relationship between COVID and also mental health. And then I think we will be moving on towards tips and things that we can do to actually maintain mental health in this coming few days, months, and also hopefully not in the next year. So I think as a start, let me just introduce you a little bit about Care Warriors. So this is our first inaugural event. So we've had a number of sort of small events that we've co-hosted or participated with others, but this is really the first one. So I'm going to be apologizing on behalf of the team if things don't run as smoothly as you'd like it to be. What I also want to do is invite you all to join us. So this is a community-based non-governmental organization which actually started in Subang Jaya by the YB over there in view of the cases that she's noted in Subang Jaya. We've then moved on and taken this particular small group of people into a little bit more mainstream and trying to look into areas of mental health that we can all participate in. So at the moment, we've got about 60 volunteers, and we're just looking at more volunteers to join us in order to spread the word about mental health and the cause and the mission that we've decided. So as a vision, we want all Malaysians to have access to knowledge and skills to maintain good mental well-being. And we're going to be starting today's conversation a little bit about that and also linking it to COVID. Our main mission is to actually raise awareness on mental health We're also looking very closely at issues on suicide prevention. So these are going to be our two main areas, and how we want to do this as a group is actually to spread training, knowledge, and hopefully get some of you here involved with a lot of activities to build resilience for yourself. So we really believe in empowering all of you with good mental health skills so that you can actually take your health forward in a better way. So just to share a little bit about some of the activities that we've had in the past. So this is pre-COVID in 2019. This is probably one of those events that was under the old name, Subang Jaya Care Warriors. Good turnout over here, and the whole idea was actually to reach out and discuss a little bit about mental health. They've also had other activities like this one over here, which is another community outreach and campaign in one of the malls in this area. As I've shared just now, I think once COVID has actually settled, we'll probably be having more of these activities on a more broader scale, hopefully within the community, so that all of you here can also participate in. So that's just a little bit about Care Warriors and what I'm going to be doing over the next 30 minutes or so, hopefully. And why do I say 30 minutes? Because I'm really looking forward to take in questions that you might all face or have that we can actually have a bit of discussion. Now, the good thing is that my co-moderator, which she's been very polite not to introduce herself, is also another psychiatrist as well. So, you know, between the two of us, we can probably take a number of your questions that you might have as well. So for my topic today, as I've mentioned, we're going to be talking about COVID pandemic. And I want to start this conversation by asking all of you let's see whether this thing actually works, yeah? To actually participate with me in joining menti.com with that particular code, 51667820, and just share with us a little bit about how are you feeling or how have you been feeling over the last 2 weeks since this recent MCO. Could we get some people to see if this thing works? And I'm going to give myself also the opportunity to try this. Okay, sadly, it doesn't seem to be sharing the way that we would like it to share. Nevertheless, anyway, so it looks like this technology doesn't seem working when we want it to work. But I wanted you just to reflect and think about how have you been feeling over the last 2 weeks in light of this recent MCO. And then I think we'll be moving a little bit on with the discussion about the topic that we've got. So just to recap a little bit, we're going to be talking a little bit about health and why I think mental health is important, and why I want all of you here to also take on board why mental health is important and share that news and information around to others. Again, we'll be talking a little bit about the COVID issue and how it relates to mental health. So as a start, health is actually a state of complete physical, mental, and social well-being in the absence of disease or infirmary. I think it's really important for us to take note that health has 3 aspects. Yeah? It has physical health, which we often invest a lot of our time in terms of exercise. It is also involving with social well-being, where individuals are able to communicate, for example. But at the same time, mental health is also one of the third component and an equal player in the aspects of health. So if you've got one of these 3 particular domains that are not actually doing really well, in terms of probably being overly stressed, for example, or having some difficulties, then you could be considered to be unhealthy. So an individual who is healthy needs to have all 3 domains put into place. And mental health is actually the ability to be able, for example, to reach your full potential, to be able to manage stress really well, to be able to be working productively, and more importantly as well, is to be able to provide back to society. So if any of these three aspects happen to be compromised, these four aspects happen to be compromised, and there's no explanation in terms of physical health to actually explain it, nor is there any social well-being issues that might explain this particular issue, then therefore the individual could be considered to have poor mental health. So we know that during this particular period, some of you are already facing a great number of stress, be it internally or externally. And if you're unable to handle that stress and it starts to affect you, then therefore you probably are moving along the trajectory of having a poor mental health, which needs to be addressed. So I think this is where it's really important for us to take note that mental health is in equal play and equally important in terms of health. So where is it important? It's important in all aspects of our living, whether it is us as a child, and it's important for children in terms of the development, for example. It's important for us as young adults in order to communicate, to actually live the life that we want, to reach the full potential. It's also important for adults in terms of their communication with their spouse, for example. It's also important for us at work. And more importantly as well, as we grow older, mental health becomes really important for us to have the quality of life that we want in order for us to live a meaningful and also hopefully a prosperous life. So mental health is important in all aspects of our life. Even though some of you might have not considered it before, but as a result of COVID, as I'll share with you later, mental health seems to be a very prominent issue that seems to be moving forward in terms of affecting us. So what is the COVID-19? So I think Dr. Lim had mentioned a little bit about what's been happening over the 1.5 years, and I think all of us have probably heard about this virus called COVID-19. But some of you might not have been very familiar with the word pandemic, and often even for us in medicine, it's not something that we often hear because there have not been many pandemics recently at all. So probably there's some words that you might not be familiar with: endemic, epidemic. And eventually, if this epidemic, which is a confined area, starts to spread worldwide, then it's considered to be a pandemic. So one of the other pandemics you might have heard, but probably did not realize, is actually the HIV pandemic. But however, epidemics have often been discussed at length in terms of various issues in the country and also beyond. So one of the more important things about a pandemic, as described by the WHO, is that you can see this kind of transition. And I wanted you to just read a little bit about this. So they said that there's 6 particular phases where a pandemic starts to develop. Yeah. So this virus, for example, in this case, circulates among animals as they shared, and then it will be detected in animals, and then animals to human, then human to human, and then there's going to be human spread before community outbreak happens. So the moment you reach to number 6, community outbreak, then it's said to be a pandemic, particularly if it crosses into other countries. And as you know, in COVID-19, it's crossed across the whole globe in every country that we know of in the world at this point of time. But it sort of reminds me a little bit about this movie that I've watched before, and I think some of you might have watched, which is the Planet of the Apes, yeah? And I think in one of the newer series of Planet of the Apes, the last bit here, if you recall, was the virus actually spreading to this pilot and then spreading across the world, eventually leading to the problem or the show itself, where the apes become more humanized compared to men, who start to lose their ability because of a virus in this case. So it sort of reminds me a little bit about this when we're looking at the 6 phases of the pandemic that we saw just now. Now, how does it relate to mental health? Now, we know that COVID-19 has a direct or indirect impact towards people, in particular mental health issues, by introducing new patients and new people into the equation. People are struggling as a result of the COVID-19 impact, be it financial, be it social, be it environmental. Yeah. As a result of that, individuals are developing mental health issues, which has led to a crisis proportion, where some of these learned individuals, including the World Health Organization, had sort of mentioned that we're also dealing with a hidden pandemic. So a lot of our investment is actually focused on COVID-19. However, at the same time, if you have not realized already, there's also a rise in individuals struggling with mental health equal to the number of people that are struggling with COVID-19. And I'll share with you some of that information later. Now, the impact of COVID-19 towards mental health, I think, is profound. And research has shown that it's probably going to be long lasting. Whatever we're seeing right now is probably going to last for a number of years, even post this particular event. So if you're looking into some of the data, this is some of the early information that was gleaned on how mental health was affected as a result of COVID-19. So this was one of the first few studies that was looked at the healthcare workers of those in China, where this first was actually detected, where these were healthcare workers in the thousands that were reporting high levels of distress, anxiety, depression, and difficulties in sleeping as a result of their involvement with addressing COVID-19. Now, a number of you might also be facing the same particular symptoms as well, because this is also what we've seen as well in the country. We did sort of a little bit of a signal thing with befrienders. This was sort of in early last year, where you could see that people were struggling as a result of the early movement control order as a result of the COVID-19. So the movement control order itself has resulted in its own mental health issues. And the ones that we're going to be discussing today is going to be about pandemic fatigue and also a little bit about pandemic burnt out. Yeah. So these are sort of the kind of signals that we've been getting as well. Now, prior to this particular incident, it was said that in the country, about 3 in 10 or 1 in 3 individuals were struggling with a mental health issue. You know, a think tank called Center.my had just recently come out with some information which was quite important to share with us that probably nearly 50% of Malaysians are now struggling with a mental health issue. So we're not dealing with mental illnesses at this point of time, friends. We are actually talking about mental health situations of either increased stress, possibly difficulties in sleeping, depressed mood, and probably some level of anxiety that you might have not actually experienced prior to this particular 1.5 years. The MCO has actually, as we can see later here, exacerbated this little bit of a problem. So these are 4 time points in our journey in the country that was reported by colleagues of mine in the university. And you can see that at every time point over the course of the year, the stress level, the depression level, the anxiety level has increased. So if you're feeling a little bit out of sort over the last 1 year, this is probably one of the explanations that you could sort of tell yourself what's happening. Because despite all the efforts that we've all done collectively, we are dealing with stress at a high level, whether we realize it or not. And again, research has shown that this is across the board, where nearly 1 in 2 of us are actually dealing with this. So I did sort of a reflection about our journey here in my practice, at least, over the course of the last 1.5 years. And this is what I've realized happening. And, you know, it sort of fits a little bit with the research that was actually shown by my colleagues, Professor Wong, in the Department of Social Preventive Medicine, where at the very beginning of last year, when we were dealing with COVID-19 and this introduction of 2 things, yeah? First was the word pandemic, and second was the word movement control order. What we noticed was individuals that were already struggling with some level of stress suddenly realized that the stress level just shot off the roof. Yeah, it just sort of just jumped off the roof and went overboard. So these guys were probably balancing their lives prior to March 2020, and then suddenly the pandemic happened, the MCO was called upon, and then the stress level just went up. Particularly when we initially thought that it was just 2 weeks. And, you know, sort of history is repeating itself now, isn't it? We're wondering whether we're going to continue this MCO or not. So, you know, initially we thought it's going to be 2 weeks, and it lasted for up to 3 months at that point of time. So these individuals were coming forward. So these are individuals at risk, but have never been diagnosed, never had a problem with, they had a bit of a problem with their mental health issue, but it's never actually affected them at any proportion. But at that point of time, they started to come forward seeking help. Now, around me, individuals who were already struggling with a mental illness were unable to cope, and they started coming forward. And if you remember, it's around May, June that we actually released the movement control order to something a little bit more relaxed. And I can't remember, like Dr. Lim, in terms of the number of, RMCO, EMCO, whatever MCO, but it's during that period of time when things were a bit relaxed that our patients came forward. Individuals that are already struggling with mental illness and mental health issues came forward at that point of time. Now, things were a little bit hunky-dory for a little while, if you remember. And then suddenly around October, cases started to rise again. And at this point of time, individuals that were already struggling or have exhausted all of their resources to cope had started to come forward. You have to remember that if you started to lose your job around April or March, it's around October that your savings would have suddenly been running out. Yeah. So these individuals were already sort of dealing with their issues for that period of time, and then come around October, they started to seek help. But it's really around February when people were really struggling that we're seeing more and more cases. And if you remember and recall, over the last 2 months or so, we've also heard a number of cases of untimely death that have happened. I know some of you might have received, sadly, some WhatsApp videos of people that have taken their lives a little bit too early. It's during this period of time. So we understand that people are struggling. And we know now in June, really things are starting to be quite critical. And that's another reason why we decided as a group to really start discussing about this issue of mental health and COVID-19 and the pandemic, and also the movement control order. So what is pandemic fatigue? Now, some of you might think that pandemic fatigue is something like burnt out, just being tired, fed up. But actually, if you look at the definition of pandemic fatigue, which is actually already incorporated by the World Health Organization, it's actually this attitude of indifference as a result of the prolonged chronic stress that we're all dealing with as a result of COVID-19. And in Malaysia, it's the prolonged MCO that's happened. As a result of that, if you recall, over the last 2 or 3 months, people have been a little bit more relaxed in terms of following the SOPs. They've not wanted to wear masks, or they wore it a little bit inappropriately. They might not have wanted to distance themselves as we used to do over the last course of the 1 year. They might have actually been a little bit too early to actually put out their hand for you to shake it. People are becoming a little bit indifferent, not because they want to, it's because they're probably tired in trying to follow the rules. And it's been described as something called pandemic fatigue. So it's a situation whereby the individual feels exhausted, due to being sort of having to deal with these issues from days, weeks, and months, adjusting to what we are now terming as the new norm. So this is sort of the kind of definition that they have here. Yeah. So it is sort of natural and expected reaction, but I think definitely it needs to be addressed and it needs to be identified. And we'll be looking at some of the ways that we can actually prevent pandemic fatigue, particularly when we remove ourselves from this particular MCO. Yeah. So pandemic fatigue is not pandemic burnt out, which I'll share with you a little bit later. It's actually just the indifference that we're all feeling as a result of having to follow certain rules for a prolonged period of time with a lot of uncertainty. And this results in individuals starting to get a bit more relaxed, a little bit more indifferent in terms of following those particular set of rules, and probably creating another issue altogether. So I think we need to identify that if we're feeling a little bit tired in following those SOPs, we're actually dealing with something called pandemic fatigue. So is this a mental health issue? It's probably a mental health issue in terms of the chronic stress, but it's not really a mental health issue in terms of our difference, because it's sort of something that we expect that's normal and we need to address this. Yeah. So what about this? Have you all experienced, and I'm going to ask you these questions because I know that my mentee.com thing didn't work just now, and you can ask yourself these questions again. Have you experienced these particular incidents? Have you started to be working more but enjoying it less? Do you feel that you need to force yourself to do routine things? Do you feel bored constantly, and need to seek some level of entertainment? Yeah. And do you feel this feeling that you just don't want to be somewhere else? So if you are already experiencing 1, 2, 3, or even all of these particular symptoms or experiences, then you're more likely than not dealing with pandemic burnt out. Yeah. So burnt out is actually something that was introduced quite early. And it was actually initially introduced in terms of work. But if you look at the symptoms and signs, they're actually transferable to other situations. It's been actually defined as a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. So individuals who are burnt out feel that their energy has depleted, increasingly exhausted. They feel that they have increased mental distance from their job or the activity that they're dealing with. They have a lot of negativity and cynicism related to the particular effort that they're actually trying to do. So if you think about those terminology, and if you're starting to feel the same way at this point of time, persistently feeling tired with COVID, yeah, persistently feeling indifferent as a result of the MCO that's ongoing, feeling that you're just so frustrated with the situation that's happening at the moment, you probably are dealing with pandemic burnt out. So signs of burnt out that have been described, particularly in this pandemic, that was described by others and reported in journals out there, is a feeling of sadness, emotional feelings of depression, sadness, failure, helplessness, and apathy. You've become easily frustrated. You start to become easily irritable. You become dissociated or indifferent. You feel isolated or disconnected from others, even if it's virtually as well. And you might have thought about something called Zoom fatigue as well, where people are just feeling a little bit, I don't want to be there. Practicing poor self-care, feeling tired, exhausted, and overwhelmed. And you might be using negative coping strategies. For example, being involved with a little bit of alcohol, a bit too much than you would like, maybe smoking a little bit more than you'd like, or maybe even dabbling into unwanted substances, for example. So these are just signs that you are dealing with signs of burnt out. And what it actually means is that you've been dealing with stress for a prolonged period of time, and your body is starting to shut down as a result of this. So, again, the whole idea of this is for you to actually identify and then hopefully be able to do certain skills or activities to reverse this. Because individuals who are struggling with burnt out, if they don't do anything about it, they will then eventually move towards having a mental illness as a result of that prolonged stress to the point that you're unable to cope and function, resulting in that loss of functioning and eventually needing to seek professional help for your health condition. So it's really something that we want to take more attention towards, particularly during this period of time. So it's been described by some, and I've had a chat with others about this. Some people have felt that it just feels like you're doing all this running, but you're not actually moving. I don't know whether you felt that, but sometimes I feel something like that. Yeah, you're doing all this work, but actually you don't feel like things have not moved. And by before you know it, it's already the 10th of June, literally the middle of the year. Yeah, you feel that, for example, the work that you're doing, if you're really burnt out to work, for example, is that the jobs might have changed, but the way they were doing, the jobs might not have changed, but the way that we're doing is different. And this is something to do with, for example, working from home. So individuals that are dealing with this whole situation that we're all in are struggling in these particular aspects. So as a result of that, these individuals starts to be a little bit more cynical. They start to feel ineffective. They just feel this intense level of exhaustion and fatigue as a result of the situation that they're in. So this is pandemic burnt out, and the consequences will often be seen at school if you're studying as a student, in the workplace if you're working, and of course for those in the family area. We can't forget that if, for example, if you're a house husband or housewife, as I often tell individuals, if you're feeling just that little bit of frustration doing the work that you're doing at home, you're probably also starting to feel the result of this pandemic burnt out, or the burnt out as a result of the pandemic that's prolonged over the last 1.5 years. So Dr. Deirdre O'Shea had sort of mentioned that burnt out is a process. She doesn't believe that you suddenly wake up and you say, I'm burnt out. And I believe so as well. I think, you probably, if you think about it, have had some signs that your mental health is starting to, become a little bit more depressed or decline, eventually to the point where you're starting to feel these symptoms of burnt out. And as I've shared with you, some of you might have actually endured the whole course where you might have then struggled into a frank mental illness, be it anxiety disorders, which is the most common problem that we're seeing in clinic at this point of time, or depression. So these are the two mental illnesses that are often associated with this prolonged pandemic, which is probably a consequence of the whole journey that we're all in at the moment. So what can we do about it? So there is hope, my friends. There's definitely a lot of hope that we can actually look, and these are sort of things that have been shared by others. And I think, looking at some of the questions that were shared to us a little bit earlier, some people have asked, what can I do about this pandemic fatigue, and other negative emotions I'm feeling as a result of this particular prolonged pandemic. So the first one is that, as I've shared with you just now, if you're feeling indifferent, if you're feeling that you're unable to cope with the SOPs that are there, and you're feeling quite guilty about it, don't be. It's actually quite normal, and that's called pandemic fatigue. But at the same time, we need to regroup ourselves and see what we can do in order to be able to be compliant to those particular operating procedures so that we all can be safe together. If you're starting to feel emotionally drained, physically drained, and starting to be a bit more negative as a result of this whole experience that we're all going through, you're probably starting to deal with burnt out. Again, identifying that you're struggling with burnt out gives a name to that feeling that you have. And as a result of that, you can actually do something about it. So the second one is probably to adjust the expectations as needed. I think some of us here have actually assumed and thought or believed very strongly that we probably will be out of this by now. Actually, to be fair, I'm one of those as well. Even though I was a little bit more skeptical, but I thought, oh, maybe 2021 things will be a bit better. But we can see that things are ever changing. It's so fluid. It's not just Malaysia. It's also across the globe. In fact, Singapore has just called upon some resources. We're seeing rises again of cases in other places as well. So it's just across the board that this particular situation is changing. So we also need to adjust our expectations. Yes, we need to hope for the best, but at the same time have some contingency plans if things are not going the way that we would like. Be flexible is basically another word to say it. The third one is probably to set some level of structure or routine. For those of you that are dealing with a lot of negative emotions, having a routine actually is able to obliterate all the sort of uncertainty that you have as a result of this particular ongoing pandemic. Because if you have a routine, whatever happens in your routine, that is your world. The moment you don't have a routine, you're sort of experiencing what the world has to give you with all the uncertainties. Therefore, it causes sort of an overwhelming level of emotions for individuals. So if you're a person that is highly strung, that needs some level of structure, for example, then by all means have a routine and stick to that routine, but be flexible in adjusting that routine according to the circumstances that are happening. But have a routine, because when you have a routine, then you're able to obliterate all the uncertainty that happens around. And as I've shared with you just now, be a bit more flexible in your day-to-day activities. If you've got A, B, C there, for example, all lined up for you, be able to be a bit flexible to do B, C, A, for example, or maybe C, B, A. If you're very rigid in starting to say A, B, C, it might be a bit difficult because sometimes the rules also change at the last moment. And this sort of causes a lot of individuals that might not be able to move across this rigidity or might not have thought about it to be very distressed as a result of that. So these are some of the things that you can actually do. What are other things that we can actually do? This is particularly looking at pandemic fatigue. I think it's really important for us to share stories to understand the risks and consequences. I think, knowing the risks, for example, sometimes is not enough. Being able to put context into that risk allows us to have a different meaning about why we're doing certain things. As a result of that, this might reduce the pandemic fatigue that we're having just now, because we're looking at it at a different point of view or a different light altogether. So for example, we're often told to wear a mask. We now need to know why we need to wear the mask. And people are now sharing stories of, spread that happens as a result of individuals not wearing masks. in very small spaces, even with small groups of people. So I think having a story might allow us to reflect back and say, hey, I think this is why I need to do these certain things. Or maybe listening to a story of a negative story of someone actually falling ill might also give us another view of why we're doing the things that we're doing. Putting a different meaning to this, this same story that we're seeing at the moment, because that sort of allows us to sort of, refresh back the need or the reasons why we're doing certain things. I think in order for us to, move forward and also try to live a normal life is also to find ways to make activities safer. Sometimes there are things like COVID or social bubbles that people have done where they keep their groups really small, knowing that these groups are safe. So, you and I don't go out. Therefore, if you and I meet, then we only have, us together, which means that more likely than not, if I've got no COVID and you've got no COVID, then when both of us meet, we probably don't have COVID. But if you're the person that moves around, then you create a level of safety issues for the bubble that you're trying to create. Yeah. And this is why, some of my colleagues, for example, if they're working in the COVID areas, for example, in the wards, for example, during the height of COVID, they would have probably removed themselves so that the families are able to mingle easily, but they will be in another space to prevent that from happening, from any untoward incidents from happening to the families, for example. So these are just some ways for individuals that they've made. Keeping supplies is also another thing that's been reported. Rules change. We're quite lucky that sometimes they tell us an MCO is coming 2 days from now, so you can actually do something tomorrow. But in some countries, they've actually informed that tomorrow we're going to do the movement control order. So literally today that you're going to be ready for confinement or quarantine for a period of time. So having supplies actually reduces a level of anxiety for individuals in actually dealing with COVID and this pandemic at this point of time. What are other things as well, moving quite quickly here, setting boundaries with people in a household. We know that this definitely reduces conflict, increasing communications between spouses and family members, reduces conflict. This also will reduce the risk of developing burnt out as a result of the prolonged MCO that we're dealing with. We often forget to deal or involve our children. And I think a lot of people have come forward trying to ask, what can I do for our children, for example. I think first, we need to communicate with them and ask them how they're feeling as a result of, the situation that we're all in together. Things like the inability to go to school, the increased screen time, for example, the isolation as a result of not having friends, the online learning that is, a struggle in itself. These kind of questions really needs to be discussed with your children as well, just as you would discuss with your spouse in terms of the work that you're doing. And probably having an increased communication in terms of what to do when people are all at home together, whether you're working at home or studying at home, so that people have very clear instructions and expectations on what can or cannot be done during that period of time to reduce conflict and hopefully to reduce the risk of developing burnt out and also other issues. It's also important for us to promote well-being in our families and ourselves, which means that we are consistently checking in onto people, consistently either SMSing them, calling them, or FaceTiming them, for example, so that at least we're connected in that. And also promoting positive activities such as exercise, which has shown to reduce, risk of stress as a result of the improvement in endorphins, for example. So I think one of the things that all of us here should take on board and actually should take advantage of is the ability at this point of time for us to actually do single individual exercises outside. Yeah, I know some of us might be just staying at home, but this is not MCO 1.0 in March last year. You can actually go out, smell the air in the way and actually move around individually, of course, to reduce risk. But I think, you should take the opportunity to do so because exercise really does manage mental health in a very positive way. It's also very important for us to prioritize self-care, particularly sleep. Sleep is really important. And also probably to, develop or learn new skills like breathing exercises, relaxation exercises, or something called mindfulness, which might also be helpful. And I think finally, and this is probably my last slide here, is also if you're dealing with a lot of emotional issues that you feel that you're unable to cope already, don't wait, seek help early, and hopefully we'll be able to help you to prevent you from developing severe mental health issues, including mental illnesses. So I'm going to end over here so we can take some questions. So to conclude, mental health is a very important component of health. It's okay if you're struggling in this period of time because nearly 50% of people are struggling as well. And it's really important for us to acknowledge that these are trying times, and if you're struggling, to seek help early. So I think I just wanted to thank all of you here for being with us, and I'm more than happy to take questions as they come.
Thank you very much, Dr. Amer. That was a really informative and enlightening presentation. I've certainly learned a lot, especially on pandemic fatigue, pandemic burnout, and was trying to look at the boxes on how many pandemic burnout signs I probably have ticked off. So I hope all of you here has benefited as well. And since we have another 15 more minutes, we will move on to the Q&A, which is the highlight of this session. Right. All right, for the first question that we have here for our speaker would be something related to the presentation. I think Dr. Amer has mentioned at the end, how do we deal with pandemic fatigue when we can't even go out?
Yeah, so I think just now there were a number of suggestions that I gave for you, but I think with regards to pandemic fatigue, one of them is actually to relook into the narrative about why we're doing what we're doing. And I think repurposing ourselves in terms of the meaning of the activities that we're doing, and hopefully that will be able to create a little bit more motivation for us to go on in this particular pandemic. I think the second one is also to manage expectations. I think one of the reasons why we are starting to get very tired is because we expected this all to be over. And I think we really need to take note on certain aspects of the COVID-19 virus that we might have just missed. Number one, it's a virus that mutates. Therefore, sadly, it comes in a different form, which means that if we are unable to vaccinate ourselves early or manage the expectations of the SOP that we've put upon ourselves, then therefore this particular situation that we're all in becomes a bit longer. So I think when we understand this and manage our expectations and making sure that we try as much as we can to do our personal best in terms of managing the SOPs, then it will probably be able to reduce some of the pandemic fatigue that we're feeling.
Yeah, I fully agree with that. Managing expectations can also reduce our anxiety and fear. Moving on, probably these two is about the same questions. The pandemic has caused financial stress to many people. How should we overcome the anxious and nervous feeling, one, of sudden income loss? And the second participant has asked on how to tackle unemployment. So I guess it would be how to deal with our anxiety feeling when we are faced with stress from financial and unemployment.
So again, anxiety, as I shared a little bit just now very briefly, is going to be one of the major reasons why people feel anxious is because of the level of uncertainty. So if some of us here are in professions that are a little bit more risky or at risk, if that's probably a better word to use, then we really need to start looking at options that we have. The more options that you are aware of, for example, where to find help, maybe a safety fund, for example, will be able to reduce some of the anxiety that you might eventually get as a result of the fluctuating income that we have. If we are currently dealt with a negative hand at this point of time, where we are in financial distress, that makes it a little bit more tricky because we are unable to maneuver. However, I've spoken to some of my colleagues or friends in the banks, and I think if you're not aware at this point of time, you might not get an automatic moratorium, but if you discuss with your banker, you might be able to get some level of support that might be able just to tide you through this period as a result of this ongoing financial difficulties that we might be facing as a result of the pandemic. So these are some of the things that have shown to help or might be able to help some people out there.
Yeah, having financial struggle is real, and I've seen some of my friends also struggling with the same thing, and managing our anxiety and our nervous feeling is so important during this period, because we know that the more anxious we are, it's not really helpful for the situation, but yet it may worsen the situation, right? So following that, we have another question. This is related to how do we deal with depression and stress during this pandemic. So earlier on, I think Dr. Amer has mentioned on how do we deal with anxiety. So this question would be on depression.
So again, two of the evidence-based activities that you can do to prevent having depression is going to be have adequate sleep, number one, and number two, to actually have regular exercise. So the data is such that if you do about 120 to 150 minutes a week, and we're talking about moderate level, what I look at is something like 20% increase in heart rate, regularly, this will be able to assist in preventing depression and alleviating some level of stress. And the reason being, if you didn't know, sleep, especially deep sleep, adequate sleep, 8 hours, 7 to 8 hours of sleep, not 2 to 3 hours of sleep, 7 to 8 hours of sleep for many people below the age of 50, and above that, probably about at least up to 6 or 7 hours of sleep, does a lot of things in terms of improving circulation, improving our stress hormone levels, so that they're actually reduced. And this sort of helps a little bit in terms of stress. What does it help in terms of depression? We know that when you have deep sleep, you're also doing a lot of cleansing in the brain. So all those neurochemicals that are probably not moving in there will be a little bit, better able to do so. If you're doing exercise, for example, it improves in terms of releasing endorphins, and endorphin mimics a neurochemical called serotonin and dopamine in the brain, which makes you feel happier. So if you're doing regular exercise, it's sort of be able to alleviate some of that depressive feelings that you're having.
Yeah, I heard the word sleep a couple of times. So I guess the take-home message would be sleep well, at least 7 to 8 hours every day. And I think exercise is another one thing. Raj in the Zoom group mentioned that he missed swimming. Yes, swimming is one of good exercise. And June also mentioned on exercise. Okay, next. One participant would like to know, how do we help family members who are faced with pandemic fatigue, and what is the best way to care for them when our own mental health is being challenged?
Yeah, so I do believe that for the second question first is that you've really got to take care of yourself before you take care of others. If not, as we've shared just now, even if you're dealing with pandemic burnt out, for example, the cynicism or the negativity really can affect another person. So really addressing yourself first before you help another person is actually really, really important. That includes us as well. As doctors in mental health, if we're feeling that we are struggling, we normally take that time off in order to be able to assist you better. In terms of helping family members with pandemic fatigue, and again, when these questions, these are some of the questions that we got earlier, when these questions were set, I suspect we were probably mixing between pandemic fatigue and pandemic burnt out. So I think if you talk about fatigue, as we shared just now, having another narrative might be able to assist in terms of reframing and remotivating ourselves to be able to be a bit more compliant to the SOPs that are there. If you're looking in terms of pandemic burnt out, then definitely, it's going to be the many activities that I shared with you just now, including putting a routine, having a relaxation exercise on you, being able to exercise, sleep well, and probably eat well as well. So these are some of the things that we can actually do together.
Yeah, I think that's really true. Like, we really have to care for ourselves first before we can care for other people. But
Wow,
some
a
of
lot of
them, they
questions
are,
here, isn't it, Dr.
yeah,
Lim?
we have many questions coming in actually, even from the chat
Didn't
group
know about
now.
these ones.
Yeah, so I guess during this pandemic, sometimes people around us will be talking or complaining about the pandemic, or people who are depressed around us will keep talking about how depressed they are feeling. And we ourselves might be feeling angry at the situation when other people do not follow the SOP. Do you have any ideas on how we can deal with this negativity?
Well, I think first of all, first is identifying why we are so negative. Second is to look into ourselves and see whether this is something that is just one-off, or is it there consistently. If it's just one-off, as I've shared, it's okay to feel negative, to feel angry, to feel frustrated. However, if you are starting to have this negativity for a prolonged period of time, then you might really want to have a chat and see whether this is a little bit way above your normal sort of situation. And if it is, then this is where probably some level of systems might come in. And I think some of the things that we often talk about here is going to be doing things like cognitive reframing, which is sort of a skill under cognitive behavior therapy. Positive affirmations is another one that's been written about, having motivating or positive self-talk, which can actually encourage you to be a little bit less negative. Again, only if you're not dealing with frank burnt out or a mental illness altogether. Because once you reach those levels, then I think seeking help, professional help, will be more helpful. At the very beginning, if you're starting to deal with some of these negative emotions, then it's okay to do a lot of these positive affirmations, cognitive reframing, to actually get you out of this negativity that is emitted by others. We also have to remember, Dr. Lim, I think, and I think you've talked about this in other sessions as well, that during this period of pandemic, this whole MCO period, and even this whole 1.5 years, we've been using our gadgets a little bit more than we would like to.
Yes,
And a
that's
lot
very
of
true.
negativity comes through social media, comes through, the engagement that we have with individuals online. So actually having a social media break or having a gadget break is actually really helpful and has been advocated as well to reduce dealing with burnt out particularly.
So is there any specific way that maybe you'd like to share? How can we help those people who are negative because of this pandemic? Like ourselves might be okay, but the ones around us, maybe our friends, our family members, might be so affected by the pandemic that they keep talking about it and keep complaining about it. Is there any way that we could help them?
Well, I think for me, if they are just really in my face, I'll get them to have a chat with somebody about it, because maybe sometimes you have to remember, folks, that your negativity is not you. Yeah, it's something that's dealing with it within you. So I think if you're dealing with these individuals that are consistently giving this negative vibe and you're trying to stay away from them, you can't. Then probably it's advisable for them to talk to somebody to see whether they're dealing with other things that you're just unable to help at that point.
Right. So if you have friends or family members who needs help, now you know who you can refer them to. You can always go and look for Dr. Amer. I think Dr. Amer will be more than happy to see them.
That was not my intention.
All right, we have a few questions on Zoom fatigue and too much screen usage in both adults and children. So this
Yeah.
question is for an adult saying that he or she is feeling so tired and she needs help. And we have in the group chat here for kids who are spending too much time on the screen, Zoom classes around 7 hours, and all other entertainment are digital. Is there a way that we can help the kids to cope with digital fatigue?
Yeah, so I've been looking a little bit about this because we've seen a number of people come forward because of this. For adults, it's a little bit easier. We know that the camera, for example, that might be one way to reduce it. We also know that it's okay to say no to certain meetings. I don't know whether it's okay for some of you here, but we have sometimes 2 or 3 meetings at the same time, which has a bit different compared to before, because in the past you could say no to coming to meeting A and B and come only for C, but now they'll say, well, why don't you join us for a little while on meeting A, and then you can go for a meeting B and C, which means that you're consistently in all the meetings. And I think, as I've shared with you a little bit just very shortly, it's very hard for us to do multitasking at times. And as a result of consistently being on these devices, we also get tired, mainly in the eyes and also in the brain as well, or the head. So some of the things that we can actually do, as I've shared, is to minimize the number of meetings if you can. Second is, it's acceptable now not to be always on camera, for example. That might be one way of reducing it. But however, to be fair, it's a little bit challenging, particularly for our children, because all of their learning now is online. And I personally don't really have a good solution at this point of time for our children, apart from the fact that you'd probably want to increase their playtime away from the screen that they've been using the whole day as part of their teaching and learning. So things that you can also do at night that I've seen other parents do when they shared with me are things like, making sure that you have certain times only for the devices. Devices are used only for certain activities. And then after that, lock them up. Some people have gone drastically. A friend of ours, Dr. Lim, remember, he even took out the internet, I think, to make
Yeah.
sure that their children don't use their devices. So there are some drastic things that people have done in order to, in a way, push their children to do other things apart from just playing games or being online for 7, 8, 9 hours of the time.
Yeah, I think that's very true because some children now, when you ask what is your ambition, and they will tell me that their ambition is to be a YouTuber. So also as an adult, because children model what we do, if we are also spending a lot of time on our screens, then that is what they will learn from us. And every time when we do not want them to, I think when we do not want them to spend the time on the screen, we need to substitute with an activity for them because they will be so bored sitting on the chair, not knowing what to do. And the phone, the iPad is the only entertainment that they have. Yeah. All right. So we have it's almost 9:30. We have a few more questions. If all of you is okay, then we can continue the questions. Is Dr. Amer, will we be okay with that?
Yeah, I'm okay with that.
Okay. So let's move on. How to recover from work from home burnout?
Wow. Okay. So I think working from home is a little bit unique. Yeah. First of all, we need to understand that working from home is not working at home. Working from home is actually working, but the site is different. Most of us are actually working at home where, things have not, the work expectation has not changed, but we are provided with the same resources as we have. And I've, talked to some of the companies in terms of this, and just trying to make sure that the HR understands that working from home, as we understand it, means that you're working from either 8 to 4, 9 to 5 with 1 hour break. And often you're provided with the right equipment to do your work from home. Which also means that individuals who are struggling with this process of work from home, the first solution that you can take is actually to take your annual leave. And I just wanted to ask, of course, you don't have to answer, but ask yourself, now it's already June, how many of you have taken your annual leave? Which means that you are in a way permissible not to be available at all if possible. So if you haven't, then that's the first thing that you should be doing in order to reduce your risk of developing burnt out. Now, the second one is also to look in the process of how you're working from home. Because again, this is very subjective because it's very relatable to where you're living and how your living arrangements are. Not everybody is as lucky. We often talk about everybody being in the same ocean, the same storm, but in different boats. So for those with a bigger boat, things are a little bit easier. For those of us with a smaller boat, things are a bit harder. So working from home is a bit the same. If you have a bit of extra room, then you can make it into an office. But if you don't have those extra rooms, then you're probably doing work at a place that you often would have your lunch, breakfast, or even sleep as well. So I think it's really important for us, number one, is to demarcate certain areas in the house that you've been using for work, and you try to remove yourself from that area on times that you're not working. I know it's a little bit tricky, especially if you're working in your room, but I've seen some people that have actually put, okay, that corner is my work corner and everything else is my my normal corner. So after work or whatever the time that person finishes work, they don't go to that corner anymore. So these are just some ways that people have done to deal with preventing work from home burnt out. I would suggest personally that if you have the opportunity to make sure that you have the right equipment at home, or at least manage your expectations in terms of your KPIs, for example, because things are not the same. You don't have the same resources. It's not as easy to get in touch with people to get certain tasks done. Therefore, there must be some negotiation or some level of tolerance that should be between the employer and the employee for us to manage preventing us from having burnt out.
Right. Very useful tips for those experiencing burnout now. Okay. This is another question from our participant. He or she always feel like giving up and mental illness has become worse during this pandemic.
Yeah, so I think the advice here is to not give up. Again, number one, thankfully help is available, and it's still open for you to reach out. I'm wearing a Befrienders t-shirt here, so if you needed help, you can always call our friends at Befrienders. But Talian Kasih 15999 also is helpful for individuals. The clinic kesehatans and general practice and other clinics are also open for you to come forward if you're struggling with your mental health. And of course, the resources in psychiatry services are also open as well. So there are ways for you to reach out. And again, colleagues working in levels of counseling and clinical psychologists, both in private and public, are also open for you to access. So there are many ways. And I think now, for example, another friend of ours, NGO called Souls Health, they have some kind of online counseling service that they provide, which means that you can actually get sort of, lower fee counseling service if you need that kind of level of assistance as well.
That's right. There are many NGOs out there that have helplines, even our own KKM Mercy line. So those who need help can go through the channel that you find is most convenient for you. And if, let's say, one have mental illness, can mental illness be cured without taking medication?
Okay, so this is a question that's a little bit different from all the rest. This is probably somebody that's struggling with a mental illness. So again, mental illnesses are certain medical problems that is probably more related to emotions and issues of the mind. Yes, there are certain mental illnesses that can be assisted without medication, but there are some that you will need your medication. So I think probably the best advice is to talk to your doctor about this, because again, it's very unique to individuals. Even one depression is not the same with another, nor is one person with bipolar the same as the other person. So, talk to your doctor who you often see, and hopefully they'll be able to assist you if that's an option for you. But certainly there are conditions that we can do with behavior intervention, for example, that might not need or might reduce the amount of medications that you have.
Right. Okay, we're going to take the last question from our Zoom chat here. One of the participants asked a really interesting one. This pandemic may force us to question our own mortality, our spiritual faith, and the meaning of life in general. He would like some sort of input about this.
Well, definitely. I think a lot of us have been through a reflective period. I definitely have been doing this quite a lot as well during this whole 1.5 years. We understand that in terms of managing individuals with mental health and mental illnesses, we're looking at various components of life. Yeah. So first, for us, especially, just to give you a bit of an idea, we use a framework called the Biopsychosocial Framework. But now some of us, myself particularly, have started including lifestyle and spiritual in part of that. So if you're thinking about this in terms of dealing with a mental health issue, whether it is depression or depressive symptoms, anxiety, for example, then we're looking at all those domains. Is there a medical explanation that we could give something to assist this individual? Is there some psychological issues that we need to deal with in order to deal with this issue? Are there psychosocial aspects or environmental aspects that we can change in order to deal with this issue? How can faith and spirituality assist us in managing the situation that we're in? And can we make lifestyle modifications to actually reduce the risk of this recurring again? So, these are some of the things that we look at. So going back to your question, yes, when you're in this period of time trying to really survive, meaningful engagement becomes really important. And you've got to look at every aspects of your life and find the things that you can actually use, the tools to actually move forward. I think the good thing about humans, and this is why we're trying to promote in Care Warriors, is that they're able to be resilient if they're provided with the skills. And we've got, for example, our friend, Mr. Kai Xuan, for example, as a clinical psychologist who's developed, some tools for all of you to build your resilience. We're also working with friends in other universities. I think Taylor's College, Taylor's University being one of them, and also UNTA in looking at these particular skills for young people. So we're wanting them to give them the skills to be able to look and use those skills to address the questions that you've asked us now in order to build resilience to be able to withstand through the pandemic that we're all going through at the moment.
Wow, that is a really elaborative explanation. I hope it answers the question. Okay, so looks like we have already maxed out our time, and we hope that this session is useful and helpful for all of you. And thank you everyone for joining us tonight. Remember that it's very important that we take good care of our mental health. And if you find that you are experiencing pandemic fatigue, take action and act on it. We at Care Warriors are grateful for your participation and engagement. We hope that you have enjoyed it, and we are also looking for volunteers. If you would like to be part of us, you can send an email to us at persatuanwirakasih@gmail.com, or if you would like to donate to us, you could also donate to us at the account here on the slides. You can also follow our website on www.carewarriors.org.my and also follow our social media accounts on Care Warriors Association, Facebook, and Care Warriors in Instagram. We will be having a monthly webinar, so stay tuned for our next webinar. And those who have emailed us earlier on, we will be sending you events information. So this will be the end of our session today. Hope that you all have enjoyed it. Dr. Amer, anything else you would like to share or last words for our participants here?
No, I wanted to thank you, Dr. Lim, for the excellent moderating. And also thank everyone here for being with us and staying with us until this late tonight. So we'll catch up with you again next month with hopefully some more interesting topics by friends of ours to assist you in promoting skills for you to improve your mental health.
Okay, thank you and good night, everyone.
Okay, bye-bye.